All right, episode number 2. Now, this actually feels like a real podcast now because I did it 2 times, even though I said it was gonna be 1 a week, and now it's been 2 weeks already. But this is not gonna be a continued trend. I'm just figuring out my schedule, how to set it up, how to get it in, how to be consistent. That's the key. Um, how do you actually make something stick? How do you make a habit stick? That's what I teach everybody in my program. Right? Yes, you have the right movements and exercises and strategies, but how do we actually get it to stick? Because it doesn't mean anything unless it gets incorporated into your life. So that's what I'm figuring out for the podcast. But today, the first episode where we're getting to something concrete is going to be about jaw pain, because that's how I even got into this whole world. It was getting into TMJ disorder and treating that. And at first, I treat everyone the same. We're going to massage this. I give you a couple stretches, stand up straight, fix your posture. Okay. And then I started to realize, wow, like people are having all different kinds of responses to this. Some people do good, some don't. And then you start getting deeper and deeper and taking more courses and learning more anatomy, and you start seeing patterns. And you're like, whoa, there's so much more going on here. And over the years, I was able to bring it into 3 buckets that I classify people's jaw pain coming from. And if you follow me on social media, you'll see I went on NBC and did a segment on this, which was kind of funny because they were like, yeah, like we want you to come on and talk about jaw pain. And I was like, well, I need to bring props. I was like, I need to bring skeleton heads. There's 3 skeleton heads I need to bring, and I need to represent the jaw on one. Well, each of the buckets, which I don't want to spoil yet, but each of the buckets. And I'm like, and I'm going to glue stuff on there. And then I'm like, we're going to need a table too. So we're going to need a table. And then I got into the segment, and it's funny because it's a 4-minute segment, right? And you have the producer in your ear, and he's like saying like, all right, 2 minutes left or like 10 seconds left. And then the anchors are trying to have conversations with you. Like it's kind of scripted. You have a general idea of what you're going to talk about. They try to throw in natural questions. But because I was so hell-bent on getting out what I needed to say, it was such a happy medium. Watch the episode. It's actually pinned to my social media, but you can find it because I've been on for 4 times now. So this was the second one. And it's such a balance between trying to answer their questions, but also control the conversation to make sure you can get to all your points. I'm like, I need to get this out or else it's not going to be clear and no one's going to learn anything. And it's just going to be a BS, TV episode where it's just like, you don't actually get to the root of anything. So it's like, you're trying to get your thoughts out, but not be rude, but answer the questions. And I don't know, it was exhilarating. I loved it, but you should watch that because that's a 4-minute recap of this episode, which won't be that long anyway. But let's go to the 3 buckets. So the 3 buckets are: number 1, an actual problem with your TMJ, the temporomandibular joint. That is when you open your mouth, there's a hinge point, there's a joint. And the joint that opening happens around is the TMJ. It's actually right in front of your ear. And what's funny about the TMJ is people say, I have TMJ all the time. I have TMJ, I have TMJ. TMJ is actually the temporomandibular joint. It's a joint. So that's like saying if your knee hurt, I have knee joint. I have knee joint. Or if your shoulder hurt, I have shoulder joint. I have shoulder joint. I have TMJ. The actual term is TMD, temporomandibular disorder. That would make more sense because that's saying that area is not functioning correctly. It's kind of like saying I have knee problems. It's a little closer. But when something goes wrong with the joint, that is one of the things that causes jaw pain. So remember, everything about this episode and this topic is about people have pain on the side of their face. I have pain on the side of my face. My jaw hurts. What's causing it? The first bucket is the temporomandibular joint. The joint has a problem. The second bucket is called the neck bucket because when people have neck problems, the pain goes into the brain, into this place called the trigeminal cervical complex, and it gets processed there, and then pain gets shot back out the wrong end towards the face because the trigeminal cervical complex connects the neck to the jaw. So you have a neck problem, and it's kind of like a mistake. It's like the brain, the body, our creator, whoever that is, made a mistake, and instead of you having a neck problem and feeling it on your neck, you have a neck problem and you feel it on your jaw. And so I can't tell you how many people came in and told me, I have TMJ, my jaw's killing me. And after I look at them, I say, you have a neck problem. Well, let's just do this for your neck and the pain will go away. Nothing to do with your jaw. So the first bucket is the TMJ, a problem with the joint. The second bucket is a problem with the neck. And the third bucket is the stress tension bucket. So the stress tension bucket is there's nothing wrong with the joint in there, but your muscles are sore. Your masseter, your pterygoids, your temporalis, like that's where the pain's coming from, the muscles, not the joint. And what causes this? Clenching, stress, using your muscles the wrong way. It's a muscle problem. And so when we look at all these things, it's like bucket number one, a problem with the jaw joint. So if we just try to fix the muscles in your neck, we're not going to help the joint, so the pain won't go away. The second bucket is the neck. So if we try to fix the jaw joint or the jaw muscles, the pain doesn't go away because the neck is the problem. And the third bucket is stress tension. So if we try to fix the jaw joint, that's not going to do anything. If we try to fix the neck, that's not going to do anything. But if we try to fix the factors that produce that stress and tension and overuse of the muscles, we can address it. So those are the three buckets. And again, if you want a visual of this, go to my social media. I think it's pinned. Let me actually check right now. Let me see if it's pinned on my Instagram. So I'm opening my Instagram right now. And yes, it is. It's the second pinned one for this. So you could actually watch the visual of this. So now that you know the three buckets, let's actually get into each of them. You're having jaw pain. If you are in the TMJ bucket, the joint bucket, this is what your history might look like. You've may or may not have had jaw locking, where the jaw kind of locked, you couldn't open all the way, couldn't close all the way. There may have been a specific incident, like you may have got hit in the face or fell or an injury a long time ago and the jaw itself had an issue. You may feel clicking and popping, okay? And your pain is probably right at the joint. So pain in the head area spreads all over. And every time I see someone who has jaw pain, it's a different story. I have jaw pain and I'm dizzy. I have jaw pain and I have headaches. The next person says, I have jaw pain and neck pain. The next person says, I just have jaw pain. So many different combinations. But one of the things you will be feeling is pain localized to the jaw joint, which is right in front of the ear. So if you stick your finger in your ear and then move it forward about, I don't know, like a half an inch or 2 centimeters, move it directly, stick your finger in your ear, in the hole, go forward a centimeter or two, and then go down about like 1 centimeter. It's like right there. It's right in front of the ear. If you open and close, you'll feel the bone moving there. That's kind of the region where you feel it. You also may have ear symptoms, fullness, clogged ear, ringing, aching, because the jaw joint butts right up against the ear. It's right up against the ear. So just the movement and inflammation that can be in the joint can cause ear problems. Plus there's other muscles that attachments as well. We said clicking and popping, and here's the big one. It's painful with jaw movement. So when you eat, chew, talk, open wide, yawn, kiss, etc., you move the joint, that's when you feel it. Now, it still may hurt, like when you're going through your day, you're just hanging out and it's just aching, but you definitely feel it when you move your jaw, and it's right in that area. Now, if this sounds like you, one thing that we can do is a little range of motion testing. So if you're saying, this kind of sounds like me, maybe this is me, let me hear this out. Open your mouth all the way wide and close. Now shift your jaw left and right and left and right. Now shift your jaw forward, back, forward, back. Now open, close quicker, like just kind of go in little circles, move it around. Do you start to feel something? Put something in your mouth, start chewing on something, eat a little something, or just kind of take anything near you and just kind of gnaw on it, a little rag or paper towel or something. Does that start to activate that discomfort, especially kind of closer to the ear? And it could be a little, this refers, so it could be a little bit further in front of the ear by the cheekbone or down by the bottom of the jaw, but like, is it kind of in that region and it's a little bit like more localized? Now we're saying, okay, this actually sounds like this could be your bucket, the TMJ joint bucket. Now, just some starting points for that. A night guard can be helpful because what it does is, if you think about it, if you can't get your teeth to touch at night, and so you put something between your teeth, a night guard, and I like just like a classic flat, plain, hard acrylic, and it spaces out your TMJ. Now that compression that's going on in there, that inflammation, that irritation can be decompressed. It's being stretched out all night, so it's giving a little bit of relief. But now we need to add in movements that are going to stretch the TMJ itself. Okay, there's specific movements we could do. We need to retrain it. So if it's, you may notice that your jaw shifts side to side when you open. We need to use different strategies to start stretching out the joint and then retraining the way it moves so you can get more normal mobility. And you would be amazed at how much relief you can get just by starting that first part of a protocol that we would use. Because again, the joint is the problem. You have TMJ. You have knee joint. You know, what can I say? The next one is referred from the neck. So if this is your bucket, you may have noticed, so you could have had an incident like a whiplash or something like that that caused it, but there may have been a slower onset of symptoms, like it just kind of built up over time. You may also have neck pain itself, headaches, dizziness, burning eyes. These are all things that the neck can produce, the upper neck specifically. Now, your pain may be a little bit more diffuse, like, yeah, my eyes, my kind of whole jaw, it's not in that specific area, kind of towards the front of the ear, like in that, no, it's just kind of all over my jaw and like side of my head hurts a little and like, I get my eyes, like I said, burn, like it's more diffuse. And there's not a specific pop or shift of the jaw. And you may notice that it acts up more if you've been sitting at a desk for a while. Or maybe for some of you, it's like when I exercise, it really acts up. Not when I use my jaw, but just when I like exercise, my neck and everything has to move. And one of the ways we test this is we can simply go through a cervical range of motion. Like for you right now at home, turn your head all the way right, all the way left. Look all the way down, all the way up. Sit in a really good chin tucked posture. Bring your head all the way forward. Do you feel anything there? Okay, if not, let's try this. Sit in the best posture, the worst posture that you can. Slump all the way down. Bring your head forward like a chicken and look straight ahead. So it's like you feel a lot of pressure in the back of your neck because it's like arched back. I want you to sit like that for 1 minute. Now, I don't know how podcast protocols work since this is only my second episode, but I don't think I should just sit here for a minute quietly. So that's what you would do. And then does that activate your symptoms more? Or stick your fingers in the back of your neck, kind of poke back there. What do you feel? Okay, these are all things we can start trying to assess to see if it provokes your symptoms at all. And if this is your bucket, you could see we're trying to see if the neck is correlated with this. You're going to notice that optimizing your ergonomics. So like, what do you do during the day? Are you sitting a lot? If so, we need to change your ergonomics. Are you standing too much? Then we may need to get you out of that position. We need to make sure that you're not looking down too much, or you make sure you have the right pillow, or you're not sloped in a bad position throughout the day. But we also need to look at the neck and use specific corrective movements. Are you rotated to the left? Are you compressed back? Are you shifted forward? Like we need to then use these specific movements that we have you do multiple times a day to start breaking up those restrictions, adhesions, whatever term you want to use, to start freeing things up. And then we retrain the movement of the spine, but also the shoulders, because all the shoulder muscles connect into the neck, a lot of them. But if you're overusing the shoulders, the upper back is stiff, it's going to end up pulling on the neck and the head, and the pain is going to get activated in the upper neck, go through that trigeminal cervical complex, right out to the jaw. So this is the approach. So think about that. Does that sound like you? If so, this can be a neck problem. So we talked about the TMJ joint, the jaw joint. Is that your bucket? We talked about the neck. Is the neck causing all your jaw pain? And the third bucket, the stress tension bucket. So the stress tension bucket, you may notice that you're prone to stress or anxiety. You may be on anti-anxiety or antidepressant medications. You may have poor sleep habits, insomnia, or maybe you just don't sleep well. Maybe it's not insomnia, but you just don't sleep well. It's harder. Sometimes you struggle with self-care routines, or you could be completely type A and on top of everything. That's the other thing. Type A people who want to fix everything and it needs to be perfect. And I have a good sleep routine and I take care of myself. All of that extra urgency that's added onto everything can add to the stress tension bucket. And grinding and clenching your teeth is a big one. And if you don't know if you do that, you go to the dentist. Check. Have them look at your teeth. Do your teeth feel sore in the mornings when you wake up? Are they ground down? Do you have pain right on the side of your head where your temporalis muscle is? So you consider them headaches, but is it just right on the side of the head? And if you push on it kind of above your cheekbone, is it sore? You could even be above your cheekbone or back by the ear. So you're basically like above your ear and then start moving forward towards your, like, closer to the eye, that side of the head area. Those are some of the muscles that cause clenching. Or your masseter muscles tight, like your cheek muscles. Is that really sore if you stick your fingers on them? You may also feel with this like headaches or brain fog. Pain is worse with stressful situations, being overstimulated. That's when the jaw pain acts up. And you probably feel sore in the morning when you wake up if you're clenching at night. But if not, it may get worse as the day progresses because everything's building up. Now, one way to assess this I love is a pain diary. So, this is getting fun now, this podcast stuff. I think because I've listened to a lot of podcasts, I can add show notes, can I? So now, does that mean I can add a PDF there for the pain diary? That's the question. Because I have a pain diary you guys can use. Let's see if I can add that to the show notes. Or else you can go to physioloops.com and go to contact us and ask for the pain diary. Just go to that form and we can send it to you. I need to think of a more streamlined way to do that. And the pain diary is great because you break your day into the first half and the second half. And then you rate your pain level and where your pain was. But then you rate things like, what was the position I was in all day? Was I on the move? Was I sitting? Was it something like that? How stressed was I that day? How good was my sleep that day? We add up different factors like that. And after 2 weeks, 1 or 2 weeks, you start looking for patterns. Every time my pain was the highest, I was sitting all day. Or every time my pain was the highest, that's when my stress levels were high. It's a good way for you to get a grip on the perpetuating factors. It helps with figure out any of the buckets, but the stress tension in particular. Another thing you could do, because we know stress and tension activates this, I want you right now to think about how bad your pain is. Think about how much it worries you. I want you to think about how you're concerned if this is going to get worse and never going to get better. And think about the activities that it's taken joy from you. And just think about what a nuisance this whole situation is. Really think about this right now. Did your pain get worse? Did you notice your pain just in that moment I was saying those things? Sorry, I didn't mean to provoke you. I feel like I was a fear mongerer there. But if you notice that, then your nervous system is activated. As soon as you activate, the pain comes. That shows there's a neuroplasticity issue as well. And so with this bucket, we do a lot of neuroplasticity retraining. That's something that's very big in my program. We go through 12 modules of it. It's unbelievable. I'm going to do a whole nother talk on that. If you know the holistic psychologist, Dr. Nicole LaPera, she has a self-healers circle that I just did a talk in, and it was all about the brain-body connection with persistent pain. And I made it very heavy in the neuroplasticity side. And I will do that, go into that a little deeper soon, not in this episode, but it's massive. So understanding that is something we would retrain is huge. We also do a lot of muscle primers because the muscles get super beat up here. Remember, stress tension, it's not a joint problem of your jaw. It's not the neck problem. It's the muscles are really painful. The masseter, the temporalis, the medial pterygoids, the digastric, the ones under your chin, the SCM, like they're all super tender. So we do a lot of muscle work, but then we have to retrain the muscles because typically this is your bucket, if this sounds like you're overusing this masseter on this side and this temporalis on this side is not activated enough, and your neck, you keep your head forward posture so it shortens or it lengthens some of the muscles under the jaw, which change the position of the jaw. And when you lift your shoulder up, you're overusing the muscles on the left side of the neck, and so it pulls your head to the side. It puts more tension on the opposite side of the jaw. Like we do a lot of retraining of muscles because you can't just massage a muscle to make it feel better, right? What's the root cause? Is it the neuroplasticity? Is it the way you're moving? So we have to add those in. But these people, you can get very quick relief just from releasing the muscles. But that's not the long-term fix. So I want you to think about that. Those are the 3 buckets of jaw pain. The joint, clicking, popping right in front of my jaw. That's where it is. When I use my mouth, that's when I feel it. Referred from the neck. It's my posture, my positioning. I also get neck pain and headaches, and I never had a jaw injury. There's nothing, I don't hear clicking and popping. My jaw is killing me. Stress, tension. It's my muscles. No, I don't have the jaw clicking. My neck's fine. It's more when I'm stressed or when I'm activated. And here's the catch. And this is going to be a theme. It's going to be a thread throughout all my podcasts. All of these things typically contribute to some degree. We have to retrain the neuroplasticity and reduce the stress and tension and get the muscles going. We have to move the joint more and mobilize it and make sure it's functioning better. We have to get your neck in a functional position. And we will do all of that. That's the way that I program everything. We're going to do all of that because it all needs to work together. That's why I get people who have, one person has drawn dizziness, one has drawn headaches, one has drawn brain fog, one has drawn sensitive eyes, one has drawn an earache, because it's all a combination. So we need to work on all of them, but there's one that's driving it more than the others, and that's your lever. We're always looking to what's the biggest lever that we can pull to get you relief. And that's where we're going to put a lot of our focus on, but still hitting the other ones. That's the key here. I've noticed if someone knows for a fact they have a jaw joint issue and all they did was different treatments to address the jaw joint, they don't get better. Why? Because there's so much, because that's our current medical model that is up until recently has always been used. Like, just focus on the problem, just focus on the problem. Yes, you can get some relief with that, but it's always a whole picture that we need to treat. And that's by me talking about the 3 buckets. I want you to understand, yes, we need to figure out what's the biggest lever we can pull to get you the most relief. That's what we need to focus on. But you have to understand that if you don't also hit everything, you just don't get out of it. And that's what I've learned. We need to get the neuroplasticity going. We need to get the lifestyle going. We need to get the neck and the jaw and the joint and the muscles working together. So I hope that was helpful. Looks like I'm at 22 minutes here, which is not too long, but I packed a lot of information to this one, so we'll see. But if you know anyone who has jaw pain, just pain on their jaw and they're suffering, or TMJ or whatever it is, however they're calling it, whatever their doctors told them, please share this episode with them. And then go to my social media. On Instagram, it's a pinned video, but they're on all of them. And look at the 3 buckets of jaw pain segment from NBC. Watch it. It'll give you a good overview. And also, watch me and try to see if you can see in my head all the things I told you about me trying to make sure I got across all the points I wanted to say without trying to seem like controlling or rude, but answer the questions at the same time. And just see if you can I think you'll look at it in a different frame now that you know kind of what I was thinking during it. It's stressful, but they're great people at NBC, and they work with you and they want to get the best information out. So it helps a lot. But it's still, there's a million things running through your head. So anyway, check that out too. And yeah, thanks for listening. Looking forward for episode 3.